This is Herb Cohen. We are discussing today why we need to avoid prescribing or taking, if you are the person who's the recipient, taking anti-anxiety medications for anxiety and depression. This is kind of a really important subject, and it's a really critical video on making this an open public video for a reason. I really want the word to get out on this subject because it's so vital and so critical. People are really at risk. If you have anxiety and or depression, you want to stay away from this class of medications. This class of medications is known as the anti-anxiety class is known as the benzodiazepines. It's a controlled group of substances. The substances are controlled by the government for a reason. They're in a controlled class for a reason. The protected status is because they're widely abused. And one thing is that these anti-anxiety pills in our take-a-pill culture that we live in, where we are chasing symptoms as opposed to treating the cause. If you have anxiety, you have depression, and you see a prescriber, 90% of the time you're going to be prescribed a pill. And that's our take-a-pill culture. We want a quick fix, but it doesn't really resolve the anxiety or the depression. Because we're not treating the cause, we're just topically treating the symptom. It will take 20 minutes for it to take effect, and it's effective. These anti-anxiety pills work. They are Xanax, Valium, Klonopin, Ativan, Librium, and these medications work. They take about 20 minutes to work. If you take them on a regular basis, you will risk becoming addicted to them. And I will stress at the end of this video why people who have anxiety and depression are at most at risk to becoming addicted, and thus the indication for malpractice in prescribing these is so high. So let's look at this and what these drugs do and what the alternatives are to these medications that are so much more effective than these medications ever will be. So one of the things that we need to understand is that anxiety is fear. And fear is when GABA is inhibited, we experience fear. GABA is one of those neurochemicals like serotonin and dopamine and endorphins. We have an antihistamine as well, are all brain chemicals that are in a delicate dance. They're in a delicate balance with each other. And they keep each other in check. And when one inhibits the other, it's for a reason. GABA is inhibited. When there's less GABA, we experience fear. Anti-anxiety medications directly work on GABA. Now, let's say something dangerous happens to us and we experience an inhibition of GABA and experience fear. As a result, adrenaline and cortisol, other chemicals in this chain reaction, develop and are expressed. When that happens, a memory, an implicit memory, fixed stored memory, is created. That memory gets re-triggered later on in life over and over again, and then we have anxiety and or depression. So these symptoms are caused by other events where we experienced helplessness or invalidation or fear. And that's what they're a re-expression of. They're triggered memories that are re-expressing fear. Our brain has an adaptive response by keeping these memories stored in a fixed form and re-triggering them. The purpose of that is to ensure our survival, because we'll go into fight flight, and this will assure our survival. This is a normal response to something traumatic happening to us, and it's supposed to happen. We're supposed to have an adapted brain, and that's how we have survived from prehistoric times. We've evolved to this particular brain, and this is a normal process. It's not an abnormal process, even though feeling anxious and depressed feels abnormal. It's actually the result of a normal adaptive response by our brain to protect us, to help us survive. Now, the problem is that our brain doesn't know how to readapt to a normal state being one that's not in fear, when there's no reason to be in fear now. Or no reason to be depressed. So the question that we need to ask, of course, when someone comes into our office who is experiencing anxiety and or depression, is we need to ask at least ourselves, why is this person in fear? Because anxiety is fear. Or why is this person depressed? And we need to explore historically the causal reasons, so that we can target those causal reasons with therapies that would remove those fixed states that are triggering this response once and for all, and forever not have that happen anymore, and the anxiety and depression goes away. When we stop anti-anxiety medications, the symptoms come back, because all we're treating is symptoms. We're not treating the anxiety or the depressions on a causal level. We're only treating them on a symptom level. And when we do that, the symptoms don't go away, they only temporarily go away, and they come back as soon as we cease the treatment. So here is another reason why these medications are terrible. So we're screwing up the GABA system in our brain when we don't need to, because it's a normal adaptive process. Why mess around with the balance of chemistry in our brain? It's such a delicate environment that when you introduce a drug like Ativan or Valium, the brain then has to readapt to the presence of that chemical. And those readaptive responses in the brain don't go away so quickly when you stop Valium or GABA. We don't go back to our original brain state. There's an iatrogenic impact, which means that we are worse off often than before. So we have now withdrawal symptoms that can last as long as 6 months after the chemical is out of our system. Those include sweating, sweaty palms, skin crawling, nausea, feeling anxiety, high states of panic. Worse, much worse off than before we started taking those drugs. This is our polluted brain now, our toxic brain, trying to get clear of this chemical, and it just struggles with that. And this is a horrible, horrible, horrible experience. Now, at risk for that, people who have had a traumatic experience or had an unfriendly upbringing with their family, if you are such a person, you have gone into a pattern of storing implicit memory to survive. This is a survival mechanism. It's a normal survival mechanism. But people who have chronic exposure to those kind of negative events develop a pattern where storing implicit memory is our go-to. We're doing it all the time. We're doing it frequently, more frequently than someone who is not having those experiences. What we have found is those people are going to use implicit memory to store an extreme positive experience on top of feeling bad, such as getting high on a drug that makes us feel good. Alcohol, heroin, benzodiazepines, any addictive substance that we know people get stuck on will flick a switch. That implicit memory is created from that experience. This high experience on top of a negative creates an extreme state. The brain creates implicit memory out of that. It just automatically does this for people who have a pattern of storing implicit memory. And so all of a sudden, those people become dependent on this medication. And what we see is all these changes in the brain around dependency that research has shown us. We could look at all the changes, all the adaptive changes the brain makes as it goes into dependency. And this only happens in 1 in 5 people. Not everyone becomes dependent to alcohol or drugs or heroin. Only some do. And the 1 in 5 that do, are the same 1 in 5 that have anxiety and or depression. The people who have PTSD, the people who have experienced fear. Those are the people who are using these drugs because they're trying to move away from pain, from emotional pain. And that is why those people become addicted. And that is why these drugs, these addictive class of medications, are the most dangerous medications, because they are lethal, by the way, to prescribe to someone who's experiencing anxiety and depression especially. These are exactly the people who should never, ever, ever be prescribed or ever take, if you're that person, these medications. There are other medications like antidepressants that are a lot safer, but even better than that, there are coping skills that can help you change your brain in seconds from an anxious state to a neutral state, to a positive state. I have 4 pages of coping skills that I work with my clients. We do them in the beginning of therapy. That's the first thing we do, we go through each of these rapid grounding coping skills, and I mean seconds. And we just learn how we can change our brain from an anxious state to a neutral state to a positive state. And they experience this rapid change, and it's miraculous to them, and in seconds they're feeling better. They're not feeling depressed, and they're not feeling anxious. We can do this without drugs. This is simply by using the brain differently. Some of it requires some effort. Some of it is really, really easy. There's no reason to take a pill. This is faster than a pill and has no side effects. You can't overdose. You can't run the danger of dying from taking it with another medication. These are things that people are now empowered by doing because they're doing it themselves. I can regulate my brain. I don't have to feel depressed. I can do this. That means I am in charge of my own mind, and I am empowered again. I'm not a victim. That's what this supports. To get rid of the symptoms of anxiety and depression permanently, we have therapies like EMDR, brain spotting, sensory motor therapy, hypnotherapy. These therapies remit these symptoms permanently because we're using these therapies to treat the causal events. Once and for all, we go through those processes, and never again will anxiety or depression return once those symptoms are treated, once the causal events are treated and remitted. It's a permanent solution, and in the long run, we don't spend the rest of our life in 12-step programs chasing an addiction down because someone prescribed the wrong medication for us. By the way, I can use EMDR to switch off that chemical dependency if that happened with heroin and alcohol methamphetamine, cocaine, but not benzodiazepines, not the anxiety class of medications, because it's so much more complicated what these drugs have done to the brain. Whereas a simple dopamine addiction or endorphin addiction, we can use EMDR and in 30 minutes to 40 minutes switch off that dependency miraculously with no withdrawal. I can't do that with benzodiazepines. That makes these all the more reason a poor choice for treatment. I am happy for anyone to call and learn my coping skills. Eventually I'll do a video on these coping skills. I think that if we can teach practitioners options to prescribing dangerous medications like this controlled class, which I don't think should be used for anxiety or anxiety and depression ever, we can really do less harm to people and help people feel better rapidly and maybe permanently if we direct those people to the right kinds of treatment that are indicated. Thanks for watching my video. If you like this, give it a like on my YouTube channel. If you feel compelled to share this with someone, please do share it. And subscribe to my channel if you want to hear more videos just like this one. Thank you, and I'll see you again.